Hello everyone, my name is Dr. Adib. I'm a board certified OBGYN and I'm a totally independent doctor, have no financial disclosures to reveal other than this video gets enough views that become monetized. My purpose for making this video is to give you some facts and raise awareness and make people think out of the box and have them question the facts that they knew all their life, and almost we've been brainwashed about these facts. And this time I'm gonna talk about C-section versus normal vaginal delivery and give you some facts. Indeed, I should have made this video 13 years ago. When I first came to this country, I was an already OBGYN in my country, and I was in a grocery store. I still wasn't a licensed doctor in the US, and I heard in a grocery store a very young, beautiful, professional lady bragging to a male friend at the checkout about having a 10-pounder baby. And she was so bragging about it that she did a normal vaginal. And when I heard it, I'm like, oh my God, did I just hear what I heard from this rather petite lady? And does she even realize what does that do to a woman's body to push such a big baby? Does she realize the sagging of the bladder, the sagging of the rectum, gas incontinence, urine incontinence, sometimes fecal incontinence, and also some hemorrhoids? That is quite common. Of course, part of it goes away, like incontinences, they go away after a few months, but the nerve damage is still there, just to get aggravated more in the next vaginal birth. And then over time, I realized that this is something that is believed in this country incredibly. Like, I am like, what is the reason for that? Because in many, many countries of the world, people ask for elective C-sections. The higher the socioeconomic class is, the higher is the demand. That's partly because they become more educated about that. Unfortunately, in this country, insurances come between doctors and patients, and they try to do whatever they can in their power to decrease the costs and have less money out of their pockets. And that's part of the reason all these advertisements come with normal vaginal deliveries, to the point that a lot of ladies believe, and they ask and demand for it, and they push so hard for it. A lot of husbands do the same too, and mothers and significant others, they really think it's an insult to a lady's body to do a C-section, which in fact the other way around is true. Of course, the risk of having a surgery and having anesthesiology 50, 30 years ago were a lot higher. But now we are in 2019, and this is not the way things should be. What insurances do, they abuse statistics in order to prove their points, which I find very unfair. Like they were actually pointing to an article that this incontinence in gas and urine will happen to anyone with aging, and doesn't matter if someone had a previous vaginal birth or a C-section or never had a baby, they will get it with age. Hello, come on. Who would buy that? It's just like saying that because I have a condition in my eye now, and because of the fact that I'll get presbyopia at some point, I'm going to get aged eyes at some point. So let me mess up with my eyes right now because I'm gonna get it messed up anyways with age. Who would do that? What logic would accept that um, or take it? The other articles that they put it on the web all over is the articles that point to IQ of the babies, and they try to say normal vaginal birth is better for the baby rather than a C-section, which indeed is not true in many aspects. There have been some studies that said IQ of the baby is a little bit higher with C-section babies because their brain and their head doesn't go through that much pressure and compression in the birth canal, and they don't get that much oxygen deprived. And there have been other studies who said the IQ of babies that were born normal vaginal were a little bit higher, and but the difference were really negligible. It's nothing that we can really rely on and based our decisions on. The other article that were very much pointed to and they tried to advertise it between everyone, including medical staff, was the article that said vaginal birth is better for the baby because the baby's chest gets compressed in vaginal canal and the chances of fluid in the lung is a lot less with vaginal birth. If that happens with some C-sections, the length of that condition, which is called transient pulmonary hypertension, is about 1 hour. So in 1 hour, neonates' lungs fluid will get absorbed by the body. One of the risks, in addition to oxygen deprivation, which I'm going to talk more about it in a minute, is a condition that is called shoulder dystocia. That's basically getting the shoulder stuck in the birth canal, especially for bigger babies, which are very common nowadays. After the head is born, the shoulders, which are the wider part of the body, can get stuck. And at that point, it's too late to do a C-section. And it's a very stressful condition for both mom and medical personnel. And there is no way other than screwing the baby over and trying to deliver the posterior shoulder or deliver one of the arms. And in any situation, it's a lot of manipulation to the baby's body, which can have long-term effects on what we call brachial plexus, meaning that when the doctor tries to effect delivery of the shoulders by manipulating the head, the nerves that goes to the arm get severed, and a paralysis may happen in the hand of the neonate, which is sometimes transient, but sometimes, despite all the physical therapy and everything, it's going to stay with the baby for the rest of their lives. Keep in mind, everyone, that the average weight of the babies are 1 to 2 pounds more than what it was 30-40 years ago, and the bony pelvis of people have not changed that much. Of course, our weight have also changed during time because of better nutrition and wrong nutritional habits, but our bones do not change over time that quick. And also remember interracial marriages, which a small Asian lady may marry a 6'2" guy, and then the baby is way bigger than the bony pelvis, which causes what we call cephalopelvic disproportion, meaning the dimensions of the head does not match the dimensions of the bony pelvis of the mother. What made me actually make this video after 13 years of seeing it left and right and not saying anything, because if I said something, people looked at me like I have three horns, was what happened to me last week. I had two patients, one delivered vaginally and one delivered C-section. The normal vaginal birth was the second baby, and as soon as I saw the baby and the mommy, I'm like, this baby is a lot bigger than the first one. And even though she delivered first one rather uneventfully, I anticipated problems with that one. But I didn't say anything because I knew that everyone will reject what I'm saying. So she had a rather long delivery. What happens with long deliveries is that the uterus, because of overworking and overstretching, forgets to go back to normal. So it doesn't shrink, and the bleeding keeps going. It's called apnea of the uterus. And so she lost half of her blood, and she got transfusion, and she got what we call a Bakri balloon. It's a balloon that we put into the uterus to save mom's life from bleeding to death. And when I was applying the Bakri balloon, and when the nurses were getting ready to transfuse her, the only comment was, while everyone, by the way, was smiling from ear to ear, was that, oh my God, look what we go through to have kids. No one saw the problems that came with this vaginal birth, because we are all brainwashed that vaginal birth is good, C-section is bad and evil. And thank goodness she did well and she went home. But if a doctor suggested her to get a C-section because this baby is a lot bigger and this and that complications may happen, it probably wouldn't look something on the patient's chart that is acceptable. And it's a pity. It's such a pity that insurances and even some medical staff do not like that. Anyways, the other patient that I had same week and put me through so much stress that I got a severe cold, which I'm recovering from it now, was a lady that she got non-reassuring fetal heart rate, meaning there was dips in the heart rate of the baby that was not recovering and was repetitive. In this condition, we call it non-reassuring, and oxygen deprivation is very possible for the baby. So I called it a C-section, but guess what? Just minutes ago, another doctor went into the OR with another C-section. So it was heck of a stressful moments for me at 3 in the morning to have arranged C-section for that lady, get extra staff, get extra arrangements for that C-section. And I think that was why that my body defense fell. Whenever I go through a tremendous stress, even though I'm in the hospital all the time, I'm around sick people all the time. When I was recovering, I thought, why did I not even say anything in this 13 years? Even though I wasn't a licensed physician when I came over, I was still a certified OBGYN in one country. I see psychics have websites and they talk on YouTube, and I thought it's a very good idea to raise awareness and start to make people think about something that they have been brainwashed all the time. Of course, there are exceptions to the rule. If deliveries are so easy for you that happens within hours, if you want for whatever reason to have 6, 7, 8 kids, it's better to avoid C-section at all costs. But if you want to have 2, 3 kids, not more, and if you want to have an uneventful delivery, and if you want to minimize your risks, it's better to have an elective C-section, or a C-section that after a few hours of not having good progress, you can do that as well. Like waiting to go to labor, and if you're not opening up, if the baby is not dropping, it's actually a signal of the body to us that's saying that, hey, this is not going to a good direction. There is a term called aged premature, which is about ladies who have their first pregnancy very later on, and that's a change in connective tissue of the cervix, which makes it stiff, and it does not give way easy. They don't go into labor, they need inductions, and when we induce them, indeed they go not very well. So in these situations, it's a very good idea to have an elective C-section and avoid all these problems altogether. If insurances want to think smartly, though, that saves money for them too, because the cost of all the nursing care and staying in the hospital for 3 nights of induction and then having the cost of C-section, it's not to their best benefit as well. Some people might now say that why would you push for something, or why would you advertise for something that is not natural? The answer is, hey, we're in 2019. There are many things that we don't do naturally. If I want to go from San Diego to Houston, what's the natural way? That's walking, right? Who does walking? Of course, we fly or we take the car. There are risks to anything. So we take the risk of flying or driving. And it's something unnatural that we do all the time, but we don't question it. Same thing with going to grocery store. How many of you think going to grocery stores is natural? It's not. The natural thing we would do if we want a food is that we go to nature, we hunt, we may come back alive or dead or injured. But in 2019, we don't do it. We haven't been doing it since, I believe, 17 and 1800s, but we haven't changed our minds in regards to normal natural birth and C-section. Anyways, I said whatever I needed to say. Take care of yourself, and don't believe anything as a fact only because you've heard it all the time.